Hello, once again, this is Emmanuel, and we shall have an exciting episode today, and we shall be discussing about urinary tract infections. And on the other side, we have a urology resident at the Living Mwanawasa Hospital who will give us a presentation on these infections. So in general, just to give you an overview before he takes it off, for we know that the anterior urethra and part of the female genitalia are the only anatomical areas that are colonized by microbes. But transiently, the bladder might as well be colonized by bacteria or microbes, if I may say, that travel upstream to the urethra. But the anterior urethra has commensal populations with a variety of organisms, which are virulent examples of these, which we know lactobacilli, streptococci, collagenase negative, staphylococci, and many more. These are virulent, like I said, and do not participate in many of the human diseases, but there are other infections that Dr. Mulia obviously will be excited to mention. I hope you learn much from this. So let's take it off. Over to you, sir.
My name is Dr. Mlea. I am a urology registrar at Living Mwanawasa, and I was requested to give a short talk on UTIs. So what is a UTI? So a UTI is a urinary tract infection. So it's an infection commonly by bacteria of the urinary tract. Yes, you guessed it. And what is the urinary tract made of? So it is the system that is responsible for making urine, excreting toxic substances from our bodies, and comprised of the kidneys, the ureters, the bladder, all the way to the urethra. So urinary tract infections are common in women and rare in men and children, but they do occur. And if once they occur, they have a typical presentation as well as an untypical one. So to start with, a urinary tract infection can either be a complicated one or a non-complicated infection. So non-complicated is one in a healthy individual, whereas a complicated one is where the person has got either comorbid conditions, so conditions like diabetes, immunosuppression, or has obstruction to the urinary tract, so urinary tract obstruction. There are various things that can predispose someone, or that can make the risk of one having a UTI higher. Things like pregnancy, to start with, foreign bodies, so things like catheters, people with compromised immune systems, which I earlier mentioned, so diabetes, HIV infection, which is poorly controlled. Behavioral activities can predispose us to having UTIs. So things like the use of spermicides, sometimes even sexual intercourse has been shown to be a risk factor for cystitis, which is an infection of the bladder. It has also been shown that once you get a new sexual partner, you are at a higher risk of getting a UTI. Then how does a UTI present? How will a person who has a UTI feel? So commonly they may have pain when passing urine, which is called dysuria. They may experience some blood in urine. They may experience an increased frequency of urination or passing foul smelling urine. Then if the infection is higher up, affecting the kidneys, it may be accompanied by fevers, chills, or rigors. It may also be accompanied by back pain, so pain mostly in the flank area, just below the ribs on the back, either on the left or the right. and other constitutional symptoms. So by constitutional symptoms I mean things like weight loss, or basically that, basically weight loss and fever and night sweats as well. Then it is also sometimes common for people with UTIs to present with nausea and vomiting. It may be present. And once someone has a UTI which is uncomplicated, it is usually treated with medication, some medical treatment, which is mostly antibiotics. And a urine dipstick examination can confirm it, as culture is important in pinpointing the exact kind of bacteria or germ that is causing the UTI. Okay, so I think, so what things can people do to prevent UTI? So in order to prevent UTIs, because if say males, there's what is known as prostatitis, which can be very severe. It can cause pain in the groin, and even after the pain is treated, you find that the person still experiences, even after the infection is treated, the person still experiences pain. So in such a case, to treat, so I find that it's better to prevent the infection itself. There are a lot of things that people can do. If it's in a man, for example, usually hygiene is a good start. So using or making sure that the person keeps themselves clean in the groin and the genital area, having protected sexual intercourse also may help. And in females, drinking a lot of, or even in males, drinking a lot of water, just to make sure that the urine clears, urinating before going to bed, and even after sexual intercourse. Then bathing, bubble baths, or using chemicals in baths, it's not very recommended, because it can clear off the good bacteria, what is known as normal flora in the vagina or the urethra, which will make it easier for a UTI to form. There are other things like, avoiding spermicides. Spermicides have been shown to be a cause for UTI, or to predispose women from having UTIs, as well as foreign bodies like diaphragms, which stay there for a long time. So if those are avoided, it might just prevent having a UTI. So it's been great. Cheers.
So keep watching. We'll keep you posted. Stay healthy. And that was MEDINFO. So thank you for watching.